End-stage liver disease or cirrhosis of the liver signifies a failing liver where the liver is not able to perform its desired functions. These patients will present with a variety of symptoms like jaundice, liver transplantation is carried out in two ways. One is cadaveric liver transplantation, the other is living donor liver transplantation. In living donor liver transplantation, one of the family members will donate a part of the liver to the patient. Good morning, I am Dr. Jayapal, a liver transplant surgeon from Sri Ramakrishna Hospital, Coimbatore. End-stage liver disease or cirrhosis of the liver signifies a failing liver where the liver is not able to perform its desired functions. These patients will present with a variety of symptoms like jaundice, ascites, which means fluid accumulating within the abdomen, fluid accumulating within the legs, which is called as pedal edema, and they can also have GI bleed in the form of blood vomiting and black colored stools. These patients, in addition to these symptoms, can also have other organ dysfunctions like raised creatinine, which indicates impaired kidney function, and encephalopathy, which indicates that their sensorium is altered. Medical treatment options for these liver failure patients are limited, and medical treatment options can only sustain these liver patients for a short period of time. Most of these patients who have end-stage liver disease or decompensated cirrhosis will require liver transplantation if they are able to tolerate the procedure, or if they are fit enough to undergo the procedure. Liver transplantation is a complex operation which involves a multidisciplinary team and approach to perform the procedure. Liver transplantation is carried out in two ways. One is cadaveric liver transplantation, the other is living donor liver transplantation. In living donor liver transplantation, one of the family members will donate a part of the liver to the patient. So once they donate a part of the liver to the patient, the remaining part of the liver which stays with the donor will grow, and the part of the liver which is transplanted to the patient will also grow. These patients will have regenerative capacity. Normal healthy liver will have a regenerative capacity, and this is the basis for performing this liver transplantations. To perform a liver transplantation successfully, we need to have strong setup which is available in our hospital. Like, we have a dedicated liver ICU solely responsible for taking care of this post-transplant patients, and we have a competent liver intensivist and anesthesia team. We have competent and experienced surgical team where we have 5 surgeons involved in the operation and the post-operative care. And apart from the strong core setup, we also have auxiliary strong departmental setups, like we have a strong medical gastroenterology and hepatology team, and various interventions in the form of ERCP and EOS guided procedures are performed at ease by these teams. Also, the intervention radiology has a necessary state-of-the-art equipments and the competent individuals and doctors with the capacities to perform all the required procedures. And additional supportive teams like cardiology, pulmonology, ICU team and the radiology team are all well set, and we are well equipped to perform any complex liver procedures. So apart from the transplant procedures per se, we also do downstaging for the tumors to enable them or to make them fit for transplant, like TACE procedures, radiation therapies for liver tumors, TAR procedures, and the microwave ablation and radiofrequency ablation procedures. So once we decide to perform a liver transplantation, all these patients will be reviewed individually by all these teams, and then collectively we perform this liver transplantation at ease. We have the equipments, we have the setup to perform all complex liver procedures, and we are currently performing all range of transplantations ranging from living donor liver transplantation, pediatric liver transplantation, and swab liver transplantations. Thank you.